The University of Kansas School of Medicine campus in Salina was created to address the critical shortage of physicians in Kansas and is aimed at students with a strong desire to practice in rural areas. Students learn along with their peers from the Kansas City and Wichita campuses, and training takes place in local Salina clinics, the Office of Rural Physicians, and at Salina Regional Health Center. I'm Dr. Jacob Hessman, Director of Medical Education at the University of Kansas School of Medicine, Salina Campus.
Well, Dr. Hessman, thank you so much for joining me today. We're going to be talking about KU School of Medicine, Salina. Let's first talk about the history and philosophy.
The University of Kansas School of Medicine has a mission-driven objective to meet the healthcare needs of all Kansans. And the Salina campus is a natural outgrowth from that mission. We have rural-oriented students that want to practice in a rural area after they graduate. And Salina has been a wonderful location to train because that's what they get exposed to.
Let's talk about the relationship that your students have and the school has with the Salina area, both the school, the physicians, and the hospital.
So we have a very close working relationship with the local clinicians, including Salina Regional Health Center, who was absolutely vital in the establishment of our campus here in Salina. It's it developed from the family medicine residency program, who offered to bring in students to finish their third and fourth year of medical school out here in Salina because they had a rural orientation. And as our resources grew here in Salina, they realized that we could then host all 4 years and have our own separate campus here in Salina. And Salina Regional was absolutely critical to that establishment. Our first campus was actually right next to Salina Regional at the Braddock building. We've continued to grow. We now have School of Nursing out here with us as well. In total, there are approximately 72 students on campus at any given time, with 40 of those being nursing students, and then 32 medical students with 8 students in each class. Our graduating physicians, although they go all over the country to finish their training in what we call residency, which is training in their selected specialty after they graduate from medical school, over 70% have come back to practice in Kansas, many of them very local to Salina or the surrounding area.
Thank you so much for some great information, and thank you for watching. For more information, visit srhc.com, like us on Facebook, follow us on X and Instagram.